All right, welcome back to Medical Mondays. I'm Casey Mason here joining you on News Channel 5 Plus with Dr. Dawn Vincent this evening. And Dawn, we are really learning a lot about skin cancer awareness. Now, you've been a doctor for how many years?
19.
19 years. So obviously, you know, we're going to learn a lot from having you here tonight. And I want to go ahead and take this time to encourage you. Please call in. We would love to hear any questions that you have, and even, like I said, some stories. I mean, I think we all know someone who's been affected by cancer, but also skin cancer is becoming common with, you know, the things we have nowadays, tanning beds, and, you know, we've all been to that beach trip before and not using the sunscreen that we should.
Right.
I'm guilty of that for sure. But okay, Dawn, so let's go ahead and dive into a little bit. I want to hear about the background of your practice at Bellmead Dermatology. Tell us about the history, your location, where folks can find you.
Bellmead Dermatology is located on White Bridge Road. We're in the west part of Nashville, and we have been in the building for over 20 years. I've been there for 19 years. We have 4 physicians and some mid-level practitioners, and we have an aesthetic center, so we have a fairly large practice, and we treat bread and butter general dermatology problems, but we do a bit of surgical and cosmetic dermatology as well.
All right, well, go ahead and, you know, write down that location. You can go check them out. Dr. Dawn Vincent would be happy to see you. You know, is this something that, as the years have progressed, we've seen advancements, I'm sure, in being able to detect skin cancer and detect it early?
I mean, that is the key with skin cancer, is detecting it early, regardless of the type of skin cancer. Even the most potentially serious melanomas, if they're caught early, they have a very good cure rate. I mean, around 95%, similar to what you would get with a basal or a squamous cell.
And, you know, if you're just joining us right now on Medical Mondays, I want to go ahead and repeat this quote that we were talking about earlier into the segment tonight, that skin cancer is the most common of all human cancers. Now, that's all cancers out there. Skin cancer is the most common human cancers. And looking at the facts here, you know, Dawn and I were speaking that 3 million people in the United States are diagnosed each year with some type of the disease, skin cancer. So, you know, I mean, that's an alarming number. And I don't think it's necessarily an overlooked cancer, but we did agree it's downplayed. And I think a lot of that is with our lifestyles. I mean, I've got to admit, nothing feels better than when you get back from the beach and you have that nice summertime glow, but that glow can really cost you.
It really can, and I think that now there are so many alternatives from getting the tan, other than getting the tan through laying out or a tanning bed. I mean, we have self-tanners that we can use that have really come a long way in the past, you know, 15, 20 years. Spray tans are very popular. I have a lot of patients who come in who have had a spray tan. It looks like they have laid out in the sun and gotten a tan.
Oh, they've come a long way.
They've come a long way. The thing about self-tanners and spray tans, specifically with spray tans, I tell patients we don't really know how safe it is to inhale the spray tan solution. So when you're in the booth, I would protect my nose and not inhale, you know, just put a mask over my face, and then they can use like a liquid self-tanner or a tanning bronzer for the face. But generally speaking, self-tanners give a great appearance that you've had a lot of sun. They do not offer any sun protection. So people think they look tan, so they're like, oh, I might not burn in the sun, but you have to wear sunscreen in addition to the self-tanner.
Yes, that's a great point. I'm glad you brought that up. That's true. Just because you look in the mirror and you see that, you know, glow from a self-tanner, that's not the case. Your base skin is still under that. It's almost like a layer of polish in a way.
That's right.
Okay. Well, Dr. Vincent was kind enough to go ahead and bring us some photos tonight that we want to go ahead and show you all at home. Dr. Vincent, let's go ahead, kind of talk us through what we're seeing. I, by no means, am a medical expert, so I have no idea what I'm looking at here. Explain this to us.
So this is an example of a basal cell skin cancer. This is the most common of all skin cancers. So if you say 3 to 4 million people a year have a skin cancer, a lot of those people are having more than one skin cancer. So we have probably between 4 to 6 million cases of skin cancer a year in the United States. Basal cells account for about 4 million. I mean, it's basically, I tell people, if you've ever had sun in your lifetime, don't be surprised if you have a basal cell. They don't tend to be too worrisome, you know, in terms of your health.
That was my next question for you.
But as you can tell, like in this person, this is a basal cell that is located between the nose at the upper part of the screen and the lip is at the lower part of the screen. This is a pearly edged papule or bump. You can see some redness in there. Those are blood vessels. This is a very common appearance for a basal cell skin cancer.
And now, that is obviously one that we see on a face.
Right.
Do you feel like, after we go through these photos, I want to ask you maybe some more common regions. So we'll continue on.
So this is a scalp. You know, say maybe this is the part of a scalp where somebody had sun exposure if they're a golfer, you know, at the top part of the scalp. And this is another presentation a basal cell can have as a scaly, non-healing, rough patch. Most of the time they have some type of little pearly edge, but this would be a lesion. Someone would come in saying, you know, I'm putting moisturizer on this, it's just not healing, it just stays a red, scaly, non-healing patch. And then this is another example. As you can see, the lip is on the left-hand side and the nose is on the right-hand side, and this is in that little fold between the cheek and the lip. Another basal cell. It's a pearly papule. This one has a little bit of a crater in the center. So some patients will come in saying, hey, I have a pimple, you know, on my cheek, and it just won't go away. I can't squeeze anything out of it, it just won't go away. So a lot of people, if they've never seen a basal cell before, they will try to liken it to something that they have seen before, like a pimple.
That is not something I would have known to look for.
Right.
When I think of, you know, any form of a skin cancer and, you know, and detecting, I always, one of the first photos you showed, that's what I recognize. So I'm really glad that our viewers got the chance to see those photos tonight. Thank you for bringing those. And after seeing those, you know, feel free to call in if you have any questions about those tonight. I'm going to go ahead and give you that number one more time, 615-737-7587. That's 737 plus. Feel free to call us in. Free advice tonight from a medical expert. All right, so after seeing those pictures, I want to know, you know, really where on our bodies would you say are the most common regions where skin cancer occurs, or is it all over?
It could be all over, especially nowadays when we have so many patients who are using tanning beds at the tanning salon, and they are getting full body exposure with ultraviolet light. So that has become more of a problem. Historically, it would be the common sun exposed areas: head, neck, arms, hands. You know, those are the most common areas. Ears.
I was actually getting ready to say, I heard from my dermatologist years ago, she reminded me when you're at the beach or out on a summer day, she reminded me to make sure that you're putting sunscreen on the tops of your ears. It's a place we forget about. What are some other places that maybe get overlooked?
Well, the scalp, as we mentioned, that we had a photo of that. The scalp is a common area to see skin cancers, and people, because they can't see their own scalps, they're just not that aware unless someone else mentions it to them.
Now, someone like me, how would a hat, I guess?
Yes.
Or, okay.
You can put sunscreen in your scalp. You know, there are spray sunscreens you can put in your scalp. It makes your scalp a little bit, you know, your hair a little bit greasy. But
I told you we were going to learn some things tonight. I did not know that.
But that certainly can be done. A hat is the easiest way because it's more of a physical blocker. It's physically blocking the sun, whereas sunscreens are more of a chemical, you know, type of blocker. But to me, whatever gets the job done, I'm happy. I am not one of those dermatologists who tell people they cannot get in the sun. I just ask them to wear sunscreen and try to avoid any kind of sunburn. We know that even one blistering sunburn as a child can double your risk for melanoma.
Wow.
If you've had 5 sunburns in your youth, your risk of melanoma can go up by 60 or 70%.
And you know, a lot of adults, they really go the extra mile to make sure that their children have the sunscreen on when out, especially in the summertime. But I also want to remind parents, you know, keep an eye on yourself as well. And as we get older, we think we're more, you know, susceptible. We realize we still are just as much. I know child skin is obviously a little more delicate, but you also got to continue to keep an eye on yourself as well. It's great that you're, you know, taking those preventive measures for your children, but don't neglect yourself as well. I also wanted to ask about, you know, the sunscreens available out there. What are some things, as we're walking through the aisles in the store and we're gearing up for our summertime products, that we need to keep an eye on as far as things to stay away from with sunscreens and things to really start to look for that can help?
Well, the nice thing about the regulatory system with sunscreens is that the FDA mandates that a sunscreen meets a certain sun protection factor, this SPF number that you always see on the sunscreen, the cans of sunscreen. And You want to look for at least a 15, an SPF of 15, although I prefer for people to wear an SPF of 30.
30.
And it could be a lotion or a cream, but it does need to have the number 30 on the product, along with the words broad spectrum, because that means you get protection from both UVA and UVB rays. Ultraviolet B rays are the rays that burn, cause a sunburn, but we now know that UVA rays can penetrate a little bit more deeply and can be implicated in sunspots, wrinkles, skin cancers as well. So the broad spectrum means that you're getting both UVA and UVB coverage. An SPF of 15 gives you about 92 to 93% protection from UVB rays, from the burning rays.
Okay.
And then an SPF 30 gives you about 97% protection. So people say, well, what about 100? Do I need to use an SPF of 100? That does not give you 3 times the protection of a 30.
Okay.
By the time you reach 97%, there's not a whole lot of improvement that you can expect beyond that. And the FDA soon hopefully will be regulating sunscreens a little bit more, where they really can't proclaim that they have an SPF factor greater than 50. So I don't think we'll have that question much longer.
All right, all right. Well, we're learning a lot tonight. Again, skin cancer awareness is a topic here on Medical Monday on News Channel 5+. We'll be back with more with Dr. Vincent coming up after this quick break. I want to talk next about who is more at risk. We'll be right back.